Gold standard for diagnosing fibroids is simply a pelvic ultrasound, which will show the number, location and size of the fibroids. You can have fibroids inside the wall, you can have fibroids on the wall, and I'm referring to the wall of your uterus or womb. Also, some fibroids can be well hidden, so other tests can include a hysteroscopy, which is a camera test that looks for fibroids, as well as a laparoscopy. Now, while doing a hysteroscopy, if the fibroids are quite small and not too many, your doctor might choose to remove the fibroids. Otherwise, if fibroids are not causing you any problems, you usually do not need any treatment until maybe they get bigger or you have heavy bleeding and you've tried other options of treatment such as a myomectomy or tranexamic acid, and you're still having heavy bleeding despite this medical treatment. In terms of the myomectomy, it does not reduce the number and size of the fibroids. The aim of the myomectomy is simply to control the heavy periods, and that's similar to the tranexamic acid, which are basically tablets to reduce the heavy amount of bleeding that you're experiencing. In terms of definitive treatment, as I mentioned, hysteroscopic removal of the fibroids, which is something to consider if you want to preserve your fertility, as well as having a myomectomy where the fibroids are removed from the muscle of the womb without damaging your actual fallopian tube. Another treatment is endometrial ablation, which uses laser energy or a heated coil to remove the fibroid. However, if the fibroids are just too large or they're too numerous, your doctor might advise you to go for a hysterectomy. A hysterectomy is something to consider if you've tried all other options, medical treatments are not working, if you've completed your family, or if you do not have any reason to have any more children, because hysterectomy is basically total removal of the womb, sometimes the cervix and the ovaries, which means that you're not going to have any more children. Earlier on, I talked about suppressing the estrogen hormones. Now, if you consider surgery that's not hysterectomy, whether it's a myomectomy or hysteroscopy, your doctor might give you a special injection. One injection is called goserelin, and this injection helps to shrink the fibroids to allow for surgery. However, the problem with this injection is that by shutting down your estrogen hormones, it now induces a menopausal state where you get all the menopause symptoms such as night sweats, hot flushes, palpitations, fatigue, you name it. And in some women, some of these effects can be quite unbearable, which is why some women are given HRT during this period of treatment. And it has been shown that some women have actually had osteoporosis, which is thinning of the bone, as a long-term side effect of having these injections. So if you do have fibroids, whether small or large, and they're causing you any symptoms, think carefully about your options, have a good discussion with your doctor. If they're bothersome, you might want to consider medical treatment first before you go into surgery, or if medical treatment is not helping, then you might want to consider surgery. I hope you enjoyed this video. Take care.